Welcome, welcome, have a seat. So you're here for your physical exam, correct? Tell me what happened. Is there some specific reason why you're required to do this specific exam, or you just wanted me to check your overall health? Okay, I see. Did you change your habits lately? Is there something that started happening right around the moment you started having these symptoms? If you don't mind, I would like to ask you a couple questions about your lifestyle before we go ahead with the exam, okay? So, do you drink alcohol? Of what sort? And on average, how much? How frequently? Okay. So very sporadic. Do you smoke? Are you an active person? Do you work out? How many times a week? And for how? Or intense? By moderate, we mean that your heart rate is up, but you can talk. You can have a conversation. Maybe we can feel it a little bit in your voice, but for example, you cannot really sing. To give you an idea of the average heart pump you're having here. When the activity is intense, instead, you can barely talk. You're out of breath. Okay. Well, of course, physical activity is very important for the overall health as well as to fight stress. Talking about stress, do you consider yourself being usually stressed out? How many hours you usually sleep at night on average? And do you nap after meals? What time do you usually go to bed and what time do you usually wake up? And how are things at work? Is it very exhausting? Do you like it? Is it stressful? How is the relationship with your coworkers? Okay, I understand. Do you spend a lot of time outdoors? Okay, good. Well, this was just for me to have a general idea of your lifestyle, stress level, overall habits. Now we'll go a little bit more in the specific. So I will have a look at you. If you don't mind, I'm going to use this slide right here. And I would just ask you to follow it. Okay, follow the light for me. Just keeping your head steady. Please only use your eyes. Good job. We change direction. Are you okay? Do you need a break? You know that in case you need a break, you just have to tell me, right? Okay. Would you mind following the circle? Okay. Now we reverse direction. Now I would also like to check your pupil dilation if you don't mind, okay? So I'm going to cover one eye. Okay, keep looking straight in front of you. You don't have to look directly into the light. Okay. Now I'm going to do the same thing with your other eye, okay? Again here, don't look directly at the light. Okay. I would also like to check your consensual response if you don't mind. So I'm going to place the hand here, flashing the light into one eye, but have a look at the response in the other, okay? Okay, very good. You would never believe it, but if we flash the light into one eye, the other pupil, the one that doesn't have the stimulus, reacts as well in normal conditions. Let's see here. Good news is that here everything works perfectly. Okay, very nice. So, we're not done with the light yet, because I would like to have a look at the vascularity in your eyes. I have the sensation that your eyes get irritated kind of quickly. Do you spend a lot of time on a screen for work and outside of work? Do you stay on social media? Okay. No, absolutely. There is nothing to worry about. So now, I was wondering if I had your consent to come very close to you. Thank you. So what I want to do here, I want to gently, very gently lower down your lower lid, and then I will do the same with the upper mobile lid, and I will ask you to look in the opposite direction so I can really have a look at all the small vascularization of your retina, okay? It's not hard, it's just a little uncomfortable at first, but of course, if you feel any discomfort, you raise your hand, you let me know, and I will stop immediately. Are you ready? Okay, so I'm coming closer. Gently lower down your lid. I'm asking you to please look up. Very good, very good. Okay. Your eyes are starting to water. Just resist one more second. Good. Now please relax. I'm gonna give this eye a little break, so I will do the same with the lower lid action into the other eye, okay? So I'm coming closer, lowering down your lid, and I will ask you to look up. Thank you. Okay, please look up as high as you possibly can. Very good. Okay, now your eyes are starting to water. Just resist a tiny little more. Good. Relax, relax, relax. Wonderful. Now going back to your other eye, doing the same thing with the upper lid. So this time I am asking you to please look down, okay? Perfect. Are you ready? Okay. I got your mobile lead. Look down for me, please look down. Okay. Very good. Looking down is much easier, isn't it? And relax. One more effort for this visual portion of the exam, which means doing the same thing with the other eye. Are you ready? Good. I'm coming closer. I got your lead, so just look down for me. Please look down, down, down. Look down, look down, look down. Very good. And now you can relax. Okay, so I noticed that your eyes tend to dry out and get irritated very easily, but that's absolutely normal if you spend a lot of time on a screen as well as outdoors, in the light, in the wind, in the cold. So this is normal. There is nothing to worry about. I will prescribe you some drops that will keep your eye lubricated, and that they are made with camel so that they can really have a soothing action for your eyes. Okay, good. So now I would like to listen to your heart. So I will place this onto your chest. Okay. I'll just ask you to lower down the neck of your t-shirt a little bit so I can have a better experience at listening to your heartbeat, okay? Okay, very good, thank you. So it's a little bit cold. Okay, are you ready? I'm gently placing it onto your chest. Please big inhale for me. Good. Exhale. Inhale deep. Hold for me, please. Exhale. Inhale deep. Hold it. 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 Hold it. Hold it a little longer. Hold it a little longer. Then exhale it all out, all out, all out. Stay empty. Good. We're gonna repeat this once again, okay? Inhale real deep. Hold it. Hold, hold, hold. Exhale all out, all out, all out, all out, all out. Stay empty. Very good. Now please, I would ask you to turn so I will have your back. I'll ask you to just uncover your rib area for me, please, so I can listen to your lungs as well. We're gonna do the same thing here, okay? Are you ready? Okay, thank you. So, deep breath, very deep. Hold, exhale. Deep breath. Hold, exhale. Deep breath. Hold, exhale. Deep breath. Hold, exhale. Deep breath. as you can, all out, out, out. Stay empty. Very last time. Big, big, big inhale. Just hold, hold, hold for me. And release, release, release. Empty. Good. Very good job. Thank you. So, this is a very important part. I see that your lungs are clean, empty, free, and this is something that makes me feel much relieved. It's always a pleasure to see that a patient has no breathing difficulties, right? Okay, so now instead I would just love to have a look at your ears, if you don't mind. Okay, so I am grabbing my tool here. So for your ear examination, I will just come very close to you and have a look inside your ears. Okay, I'm just cleansing a little bit because I see that there is some buildup. So I'm cleaning up a little bit of the buildup here. Okay. No, I know that you're a clean person. It's probably because you are producing a little bit of excessive mucus. Okay, very good. Now I'm doing the same thing with your other ear. Okay. Okay. Just stay still and relaxed. Okay. Very still and very relaxed. You're doing amazing. Are you feeling any discomfort? You're not, right? Okay. That's good. We're almost done, don't worry. Just cleansing here. Okay, very good. Okay. There was a little more build-up here. But don't worry, I've got this. Okay. Okay, good. So your ears had a little bit of build up, but it's not something that is due to your lack of hygiene, as I said. In fact, I would ask you the permission to have a look at your throat, because I'm pretty sure you have a little bit of inflammation there, and that is what causes the ear production of build-up. Okay. Okay, so if you don't mind, I am taking my light again with my tongue pusher. Whenever you're ready, I would ask you to open your mouth real wide and say, ah. Okay. Are you ready? relax for a second. I'm gonna have one more look if you don't mind. Just really make sure it's just placed, the irritation is just placed in the pharyngeal area, okay? Alright, so open real wide. Yeah. Just a tiny little irritation. Okay. That is absolutely nothing to worry about, that's for sure. So I will just prescribe you a spray, easy peasy, and this will solve all your problems, okay? So as for the physical pain you were accusing, where is it based? Base of the neck, lower back. Okay, so if you don't mind, I would just want to have a look at that, okay? I will first manipulate your neck and see if there are things we should take care of, any maxes. We hope we don't find them, of course, or just muscular tension, whatever that can be, okay? Alright, thank you. I'm coming close, okay? Okay. Yeah, as I expected, there are no maxes, nothing worrying here. Very good. But I perceive a lot of tension all in the trapeze area. All the muscles here are very, very tense. I would like to check your mobility, please, okay? So, look right. How far can you go? Just go ahead, please. Okay, come back to center. Look left for as far as you can go. Good. Okay. Look up. And look down. Can you tilt your head from one side to the maximum of your capabilities? Same thing, other side. Okay, so yes, your mobility is a little bit affected because of the muscular tension that you are experiencing. So what I would recommend here, other than stretches, is to eventually consider applying something warm onto your neck in order to really release all the tense muscular fibers, okay? That should work. I would go with that before going for an anti-inflammatory program or something like that. So I am pretty positive that we can solve the problem by just doing so. For your lower back instead, let me have a look. So here I'm coming closer again, just manipulating the lumbar area. Okay, do you feel any discomfort if I push? Okay, how about here? Okay. Does it hurt if I touch you here? How about here? Okay, very good. Alright, so now I will have a look at the mobility of your lower back. So I'm asking you to be very careful here. Don't play the hero, just do what your mobility allows you to, okay? So I'm asking you here to go down and try to touch your knees, shins, feet, floor, wherever you can reach according to not only your flexibility but also your back mobility in this moment. Okay, and is that what you can usually do, or can you go a little further than that? Okay, good. I would ask you to twist your torso by keeping your hips stayed in this place. You twist your torso from one side and from the other side. Okay, try to grab one knee and bring it to your chest slowly. Other knee to the chest. Okay, so there is just a lot of tension that is accumulated in your spine area, okay? What I would suggest here is to do some postural correction. Pilates may be something that can really strengthen your core and allow it to protect the spine, so you'll be much more supported. I know that you work out a lot and you are fit, but sometimes these very targeted and specific exercises can really make the difference, okay? So I would definitely consider doing that. And again, stretches that can release your lower back tension. You accumulate a lot of tension there. So talking about tension in general, you have no pathologies, but all your symptoms are caused by a little bit of stress accumulation. Actually, the pharyngeal inflammation I have seen, since your lungs, as I said, are absolutely clean, the pharyngeal inflammation I have seen is related to a little bit of acid reflux. I see that you have a little bit of reflux that actually inflames the pharyngeal trade. So again, the acid reflux here is associated to stress. It is not a pathology you've had before. So of course I would like to take care of this problem in the sense that we will meet in a month and see if you still have it. If you still have it, we'll have to go for some more specific exams to take care of that problem. But in the meanwhile, I would ask you to correct your diet, eliminate coffee, absolutely go ahead with no cigarettes, and in general eat healthy, no alcohol please, at least until we get rid of this reflux. Keep going with your healthy lifestyle. So yes to workouts, yes to clean eating, clean sleeping schedule. So try to go to sleep at the same hour every day and try to wake up at the same hour the other day, even on Sundays and Saturdays, please, if you can. And let's see if this all goes away. I am 100% sure that the next time we meet, everything will be solved. You are healthy, you are fine, you're just experiencing a little bit of stress. But due to the times we're in, we're all experiencing a lot of stress. So there is nothing wrong with the way you're feeling. There is nothing wrong with the way your body is functioning right now. Just these physical signals are related to some emotional sensations that you are going through. But again, here there is absolutely nothing to be ashamed of. There is absolutely nothing to be afraid of. I am sure that the next time we meet, if you follow my tips and use the medicine I prescribed, you will be in perfect shape, just as as you always are, okay? Thank you so much for coming here today. If you like this video, please don't forget to engage with it by leaving a thumbs up, a comment, subscribing to the channel. That would be so very appreciated. And until next time,